We will now consider appropriation HES 1, policy advice and ministerial services, $1,997,490, found on page 213. And we are looking at the appropriations for the Minister of Health, Sports, Youth and Culture. HES 1. Are there any questions? Mr. Miller?
Thank you, Mr. Chairman. Through you to the Minister, I wonder if the Minister could explain to us what is the current governance structure between the Ministry and the statutory authorities.
Thank you, Mr. Chairman, and first of all, I'd like to say welcome to all of my ministry staff and the head of departments that are here with us, and thank Mr. Miller for the question. The question was what dictates the governance model for the SAGCs, was that it? So, each one of the government companies has their own governance structure dictated by the law that they're governed under. And we have 4. HSA doesn't call for a ministry rep. The CNCF doesn't have one, doesn't have a ministry rep. The museum does have a ministry rep, and which is the other one? The gallery doesn't have a ministry rep, but they're all governed according to the bylaws of the statutory authority.
Thank you, Mr. Borden. Mr. Miller?
Yeah, how then does the Ministry communicate policy to the HSA, for instance, if you don't have a minister rep on the board?
Okay, well, as minister, I have regular interaction with the board, and we do have meetings where they come, and we also have head of department meetings where we sit and discuss what's going on. But on a one-on-one basis, I have meetings with the various heads of the boards.
Mr. Miller?
Yeah, through you, Mr. Chairman, if I recall, the HSA legislation requires that if the minister wants to issue policy directives to the HSA, it has to be done in consultation with the board, and it should be done only in matters of general policy as opposed to in a kind of administrative directives. Is that what takes place now?
That's correct, sir.
How then does the ministry go about selecting members and particular chairmen of their authorities? What is the criteria that is used?
Well, some of the positions are statutory, and those that aren't, then we as a caucus, we will sit and look at potential members and discuss them with the management of the HSA, and usually that's the way that we go about that.
Through you, Mr. Chairman, did you say that you discuss with the management of the HSA board appointments?
Not as to whether they agree or not, but like suggestions that come forward, if especially for instance, if it's somebody in the field that they can advise us on whether that person is suitable, is there any issues with that individual or whatever, then I would depend on personnel for that support. But otherwise, we as a caucus basically make recommendations.
Is there any specific criteria considered, i.e. experience, qualifications, particularly for the position of chairman?
Yes, I mean, for chairman of HSA, you're looking someone with managerial experience. And in this case, the current chairman is Mr. Jonathan Tibbetts. I think he's fairly well known as a senior management of Cayman Black Power and Light. And he was also there as deputy chair before Mr. Albert Anderson left, who went on to become the chair of the Airports Authority, or the director of the Airports Authority. He was the chairman that we had put in place. When he left, Jonathan was moved up to act as chairman. And then we have the rest of the positions are all, there's an HR rep, there's an accounting rep, there's a medical rep, and so forth, an accounting rep, a legal rep, an IT rep. So these are all people that are reputable in their fields that are on the board, and I must say the board is a very strong board at the moment.
Through you, Mr. Chairman, how many policies or instructions or directives have been issued to the statutory authorities or the government-owned companies in the last financial year?
You talking about the HSA or the
All of them.
All of them. Well, in particular with the HSA, the major policy directive was the RFP that's about to go out, which is to do with the upgrading of services through the partnership with a strategic alliance with a large U.S. institution. So that directive was made clear, and that is well on its way to taking place. In relation to other boards, there was nothing really. I mean, all of the boards and management teams look at our manifesto, and whatever it is that we have outlined, by the time I took office, they were all ready with the points that were in our manifesto as their goal going forward. So that's the way that was really done. So I didn't have to give any major directives to the rest of the boards.
Through you, Mr. Chairman, you said that you have issued a policy directive that you want to get some kind of relationship with a large U.S. institution. What are your particular objectives in that endeavor, and how do you expect to achieve that?
Okay, thank you. Through you, Mr. Chairman. The goal in this regard is to have an institution that will, first of all, is a top-notch institution that we can depend on to come in under an arrangement and have boots on the ground where we have shared services, assisting us with bringing up the level of service, customer service, as well as medical care, reciprocal arrangements for our staff to go and be trained at the institution. Also, that institution would allow us to reap economies of scale from medical supplies and equipment, and seek to work towards, allow the HSA to work towards accreditation, which is something that has been a goal for a long time, but it takes time to do that. So we have to get the level of service up to the point where that would be acceptable. Also, our systems, our IT systems and our charge, adjudication systems and all that would be something that we want to make sure that we're using the most appropriate and able systems for the HSA to progress. So those were the major goals. I don't think I've left any out. Those were the major goals of that RFP, and that is going out with those listed in them. And to ultimately, at the end of the day, drive the cost of healthcare down, because naturally, if we can do more and more services here on the island, costs of services will go down.
How are you going to address liability and legal issues with the U.S. partner? Is it going to be all going to be administered under Cayman law? Or is there going to be some huge legal agreement that is going to offer the legal and professional protection that their people are going to need, which cannot be transferred outside the United States to Cayman?
Yeah, thank you. There'd be a contract on the Cayman Islands law, so the party would sign up to that, and at the end of the day, that's what would govern. We don't anticipate, I mean, God forbid that we have to get into a huge legal arrangement. I think it can be done in a fairly sensible way.
And this joint effort, the institution that you join with is going to be operating this hospital and managing this hospital?
No, not at all. The HSA is operating as it is as an entity. This strategic partnership is, and I can't speak to what will be in the agreement right now, but it will be that such an arrangement that they're not coming in to take over the HSA. They're coming in to partner with us and work side by side with us in this arrangement to improve services and quality of outputs.
And you anticipate that you're going to get a reputable U.S. institution to agree to do that to your existing institution?
So far, the interest, all we have seen has been very high. We have no reason to think that we won't.
How are you going to address the lack of quality control issues such as medical audit, peer review, medical staff bylaws, credentialing, privileging, none of which exists at the present institution at the present time? Certainly you got to put all that in place before you can attract any reputable U.S. institution. Can't do it.
Some of those things are being worked on as we speak, and of course we'd be looking to the institution. That's the whole idea, for them to assist us with getting some of those done as well. So they, like I said, we have seen no reason to think that we won't get companies interested in doing this. There's at least 5, 6 that I can think of already that have expressed deep interest in the RFP. And they know exactly what that, it will entail.
I would request that you hasten slowly. You say that you expect that such an arrangement is going to lower costs in Cayman. How is that going to be achieved?
Well, I think anytime you bring efficiency to any organization, you lower costs. This strategic partnership is not coming at any great price. It wouldn't be a humongous total that we're going to be paying to this institution to work with us. That's going to be at a reasonable sum. And I don't know what that is at this time. That has been negotiated, but whatever that is, I think that it's going to more than pay for itself in the end results, because we know full well now the problems we have with, for instance, sometimes accessing of medication, the cost of medication, accessing of equipment. We have a lot of equipment that needs to be replaced in terms of basic equipment at the HSA, like beds and room stock and different items that we can use upgrades on, and other pieces of equipment. So I think if we, from the conversations that I've had with interested parties along the way, these are things that can be made accessible to us at a much lower cost, and they see that as, at the end of the day, a win-win situation, because when they can enhance operations here, they're going to, it's going to be a feather in their cap as well. They're not looking any, what should I say, dedicated piece of business or anything like that from the Cayman Islands. It's not as if you say, well, you got to send all of your overseas patients to us. That's not the arrangement at all. They understand the cynical arrangement and the way that whole thing works. And naturally they may get some spillover onto their U.S. operations, but it's not going to be something that they're going to be mandating that we have to have this amount of business for us to do this arrangement with you. So I think all in all, it's going to be a win-win situation for all of us.
You say you're not giving them, the RFP is not going to give them any particular block of business. What is the RFP going to be in such a way that they are paid on a consultant basis? How is that relationship in what we are going to pay them to do all these things for us? Because there's plenty to do.
It will be a negotiated consultancy basis and done during the RFP process. So I can't tell you what it will be at this stage, but I don't think it'll be, as I said, I don't think it'll be a very, very, very prohibitive amount. I think it'll be something that the Cayman Islands will see is well worth what we're spending to have done. As you said, there's a lot to do, and we recognize that. We know that there are a lot of good things going on, but we also have a lot of areas that we can improve in. And I think that this is going to be good value for money if this works according to plan.
So you're planning to hire them as a consultant with the intention of converting them to your partner after they finish the consulting?
Well, it's. I think the two things will operate together. There'd be.
Friends.
You can use the word consultant, but as I said, the whole thing is a strategic partner. And whether you pay that person as a consultant or as a strategic partner, you're playing with words. At the end of the day, they're going to be providing us information and assistance on the ground and working side by side with us to improve the HSA.
Any further questions, Mr. Miller?
No.
No more. Mr. Bush?
Through you, what are the policies on hiring? Okay, let's preempt that. The last time I saw this man, he was beaten, but now, Mr. Glenn Berry, is he in charge of hiring cleaners and so forth to clean the rooms? Is that his policy to do that?
Is this, Mr. Chairman, is this question coming under policy advice and ministerial
Yes.
services?
What's the policy on hiring indigenous Caymanians?
Mr. Bush, are you sure you want to ask that question in that particular appropriation? That is advice to the minister, whereas what you're asking about is employment within the HSA.
Okay, then I'll get to that section, sir.
Okay.
Thank you.
Thank you. Are there any further questions with respect to HES 1, Policy Advice and Ministerial Services, $1,997,490? If there are no further questions, then all those in favor of HES 1, Policy Advice and Ministerial Services, $1,997,490, standing part of the schedule to the bill, please say aye.
Aye.
Those against, no. Appropriation HES 2, Health Regulatory Services, $1,024,583 on page 214 of the annual plan and estimates. Page 214. Are there any questions? Mr. Miller?
Through you to the minister, what is the purpose of the segregated health insurance fund?
The segregated insurance fund was set up to help cover the costs for indigents.
To cover the cost of indigents or to cover the cost of people who were deemed high risk by insurance companies?
Being what?
Who were deemed high risk?
High risk. No, it is for indigents.
Okay, what is the current balance and what is the projected income for this budget cycle?
One moment, sir. The projected income is 5 million. And what was the other part of the question?
What's the current balance now?
The current balance. I don't have the head.
Okay.
The head of is not here at the moment.
Well, I suggest you send and get him because unless you want to defer this vote.
It's just over 4 million, I'm told. No.
When was how is this fee structured?
I'm going to ask my chief officer to deal with these questions on the segregated insurance fund, as she has dealt intimately with us.
Good afternoon, Mr. Chair. Jennifer Ahern, the Chief Officer for the Ministry of Health. In response to the member's question, the standard or the segregated insurance fund contributions are mandated by the health insurance law. They're payable on every insurance premium, and it's $10 for a single and $20 for a family per month. And the insurance companies submit those funds on a monthly basis to the department or to Health Insurance Commission, who are responsible for the financial management of that. And the fund is audited on an annual basis. Those audits are tabled here in the Legislative Assembly.
Through you, Mr. Chairman, the 2013 CIMA, Cayman Islands Monetary Authority report indicate that the insurance companies, health insurance companies specifically, collected $171,865,000 in premium in calendar year 2012. And they exceeded 27 million, which gave a local retention of 144,227,000, and total claims underwritten expense was 133,433,000, leaving a profit of $10,794,000. Given that those numbers, does the ministry believe that there is time to adjust this fee, and when last was this fee adjusted?
Mr. Chair, through you, the fee was actually doubled when we did the amendments to the health insurance law in 2012. So it was quite recently reviewed. And the decision that was taken at the time, because this fee is passed directly on to the consumer in terms of being tacked on to their premiums every month, and given that the amendments to the health insurance law also included a significant increase in the minimum level of benefits under the standard health insurance contract, the decision that was taken at the time by Cabinet was that doubling the fee, although, as you pointed out, it compared to the cost of indigent care and compared to the projected profits of the companies, because this was a fee that would be passed directly on to the consumer, the decision was taken not to increase it any more than it was.
Mr. Chairman, I have some specific questions on health insurance on a different vote that we'll get to. But there is no current control on what premiums are charged by insurance companies.
Mr. Chair, the law allows for the Health Insurance Commission to regulate the premiums that are charged for the standard health insurance contract. But any benefit plans that are over and above that are supplemental plans that have benefits that exceed the standard benefit plan, are not regulated.
How does the Health Insurance Commission regulate the premiums?
Mr. Chair, through you. They have actuaries assist them in looking at the benefit schedule for the standard health insurance contract. And based on that actuarial analysis, the health insurance companies, they review these premiums submitted by the health insurance companies against that report. The Health Insurance Commission has basically a range of premiums that they believe is reasonable for the benefit package that the SHIC contains. And there are provisions in the law as well for individuals who the health insurance company feels are health impaired or higher risk, for the companies to charge an increased premium over the standard premium for the SHIC. But those premiums have to be vetted by the Health Insurance Commission. So the company has to make an application, depending on how much of an increase over the standard premium it is. The company has to make an application to the Health Insurance Commission, and they review it and make a determination as to whether the proposed increase is a rational one and justifiable from an actuarial basis.
Through you, Mr. Chairman, when that legislation was brought here, you will recall that I suggested to the minister at the time that the cost that his increase in benefits was going to engender in the private sector was going to outstrip the benefits that the insured would get unless the government specified a price, or at least a price range. What is the price range that the government accepts within which the private insurance companies must fall to get their license?
Mr. Chair, through you, I would have to get the Superintendent of Health Insurance to provide me with those figures. I don't have them at hand, but it is a range that's been set on the advice of the actuaries who have done an actuarial assessment of the benefits in the SHIC. So I can give an undertaking to get that for the member.
Well, I think you should publish it. I think if the Health Insurance Commission has actuarially determined a range within which the SHIC plan should be sold, the public should have the right to know. So my question is, why is it not published?
I believe that the rationale for not publishing it is because it is a range. The thinking was that if it was in the public realm, that every insurance company would come in at the top of the range if they knew that was what was out there. As far as I can recall, some of the companies have come in towards the lower end of the range, some have come up towards the higher end of the range, but I think that it's one of those figures, it's a commercial issue, that if we had it out there in the public realm, I think it would drive everybody's premiums to the top of the range.
Is it not possible to actuarially determine a specific charge for those specific benefits at specific prices? Why do we have a range?
Mr. Chair, through you, I would have to, I'm not an actuary, and I don't know what factors they've put into it, but I would imagine it would be differences in overheads and administration costs. And the other thing as well, too, is that some providers will be able to negotiate better prices from, some insurance companies will be able to negotiate better prices from some providers overseas, that they might be able to have lower premiums than others. And I would imagine that those were the sorts of considerations that would go into determining a range.
How many of the benefits in the SHIC plan?
Mr. Miller, before we go any further on this, would it help if Mr. Connolly was present to answer some of these questions?
Yeah.
I recognize that you are somewhat limited in.
Yeah.
Okay. Is it possible to? He's been called. Thank you. Let us defer the vote on this particular appropriation and move on until Mr. Connolly is here to answer the questions more completely.
Well, I have other questions related to this vote which do not relate to health insurance.
Okay. All right.
But
All right.
it relates to the registration and certification of health professionals.
Okay, fair enough.
Okay.
Yeah. Please continue.
Yeah. Currently, the health registration law allows three kinds of doctors to be registered. How many doctors are currently registered under the institutional band, and which institution have they been licensed to work in?
Mr. Chairman, we don't have that specific information at hand. We'd have to get that.
Thank you. Mr. Millerdale, undertake to provide that
Okay.
to us.
No, but you got to answer. The guy's coming here to answer it, right? Okay, I don't want it in writing.
Are you talking about, here is Mr. Marvin now, are you talking about doctors only or all practitioners?
Well, the interpolation will be the same. All practitioners, but I just asked on doctors to make the question easier for you.
Okay.
On the you wanted on one.
Mr. Chairman, I'm going to, if you could have Mr. Miller, through you, Mr. Chair, if you could have the questions that related to the chairman of the Health Regulatory Services repeated. Yeah, it was on health insurance.
Okay. I was told that the Health Insurance Commission has actuarially determined the benefits on the sick plan based on what prices have been approved by the regulatory bodies for those premiums. A range. Question I was asking, is it not possible for the actuaries to determine a fee for those benefits as prescribed for those prices that are also prescribed, as opposed to a range?
Mr. Chairman, through you.
Yes. Sorry, before answering the question, please state your name and full title.
Sure.
Thanks.
Mervyn Connolly, Superintendent of Health Insurance, Director of the Department of Health Regulatory Services.
Thank you. Please proceed.
Mr. Chairman? Yes, the standard health insurance contract has a standard premium rate, which was rated by actuaries. And the range for it is based on, obviously, the age. It's age banded. So there's a band of age starting from 0 onwards. And there's a ceiling for the standard premium rate, which has been established by the actuaries.
You say it's age banded, meaning 0 to 20, 20 to 30, 35 to 40.
Well, not exactly that age band, but
But there's a
Yes.
we're talking about the age of people.
that is correct.
Okay. How do you determine when a private insurer submits a charge for you for the sick band? Do they have to submit as part of that the age bands that they are covering?
Yes, essentially, because we've established what the standard premium rate is, and based on those ranges, The approved insurer will then submit their information in regards to their rate for the standard health insurance contract. And obviously, again, it could vary, but because we do have a ceiling that is set for it, we would know whether it's a fair and reasonable standard rate for that standard health insurance contract.
Does the law provide you with the authority if somebody comes in above your ceiling to deny them the rate?
That is correct. The law does provide that.
Have you had to deny rates?
Yes, on several occasions, we've had to deny rates.
The law was changed a couple of years ago to say that doctors and dentists must accept an insured person's card and accept that as payment. When is that going to be enforced?
It's actually, the law requires that as we speak.
Right.
So obviously, perhaps what has been reported to the Commission, there have been occasions where some practitioners, meaning, for example, an ophthalmologist, which benefits are not covered under the standard health insurance contract, they obviously wouldn't be compelled to accept the health insurance card for those benefits. But the current legislation requires all approved registered medical healthcare providers to accept the card and verify the benefits in regards to the provision of benefits under the standard health insurance contract.
But they are doctors, and particular dentists, who the insured person has to pay cash and then claim it from the insurance. You are aware of that?
Yes, I'm aware. Again, the dentist, the benefits under the standard health insurance contract doesn't cover dental benefits. So again, you know, dentists would be able to not necessarily accept a card if it doesn't provide that benefit under the plan.
But in a card will clearly inform the person given the service, whether dentist, doctor, what the benefit package is. That is a requirement under the law now, right?
Well,
Under the regulations.
The cards themselves wouldn't necessarily provide that level of information. It certainly provides the policy number, the name of the insured person, and the group, if they're covered under a group plan, an expiration date, but it wouldn't necessarily provide the level of benefits that are provided.
Yeah, I know
for
the
that.
health insurance company is too cheap to put the strip on it.
Right.
But it would give the doctor the information on the card, allows the doctor to determine whether a particular service is covered or not, even if you got to phone the insurance company.
That is correct, yes, they could do that.
In answers to your question, it seems, and correct me if I'm wrong, that the Health Insurance Commission has taken the view that the only plan that they have the authority to enforce is the SHIC plan. You have no authority over anything above and beyond that?
Yeah, supplemental benefits under the legislation, the Health Insurance Commission, except in perhaps a few occasions in regards to, for example, portability of benefits, but outside those specific requirements, the legislation does not give us the authority to regulate and monitor benefits above the standard health insurance contract.
But certainly the intent of the legislation is that, and part of your remit has to be to assist the insured person in getting the benefits that they have contracted for. Even if they're paying premiums above the SHIC plan, certainly the legislation is intended to give you that authority. You're saying that the only thing that the Commission has taken the view that they have no remit for any insurance contract that goes for any benefits above and beyond the SHIC plan?
No, I don't think that's exactly what we're saying.
Oh, okay. I just want to...
Yeah, what we're saying is that the standard rate for any of the for the standard?
No, we're not talking about rates at all now.
You're not talking about the premium rate?
No, forget the premium rate. I have a plan that says dental covered, and it'll be how many times a year I can get my teeth cleaned, what I can get, what filling, etc., etc. I go to a dentist and I put forward my plan. The dentist will not accept my plan. I come to the Health Insurance Commission and says, because I say I ain't paying you. And I say, I'm complaining about this. The question I'm asking is, don't you have the authority to tell that person that they have to accept the plan because the benefit that I was seeking to get covered was covered by my plan?
The commission would certainly, investigate the complaint, and again, in accordance with the legislation, we would determine the matter in regards to the allegations or complaint that is being made.
Is I believe, on strict interpretation of some of the changes made recently to the law, it could be interpreted that the insurance companies no longer have the right to cherry pick and have to take anybody who's in a group, and they just can't say, or once you get sick, they can't eliminate you.
Yeah, what the law says now is that certainly you cannot underwrite for the standard health insurance contract except where required under legislation.
So if I have a company and I have 100 employees and I want to buy a sick plan for 100 employees, and I have one employee who is fat, wearing a necktie, wobbling, walking with a limp, and he comes to work like that every day, and can the insurance company eliminate him because in their view he's a high risk, and insure the 99 but throw out that one?
No, not they don't certainly have that option at this time under the regulations. What would be required is that they certainly could increase the premium rate because of the risk associated with that individual, but they will not be able to refuse and deny coverage just because they have a pre-existing condition.
Would the same thing apply for people who get sick after they've been covered for a number of years, that they would not be able to say, we're not covering you anymore because you're now a sick person, you got high blood pressure?
We would absolutely pursue that approved insurer to ensure that they provide that individual with cover.
I am aware that there are people who are employed and working in very uncomfortable positions, but will not leave their employer because they fear of losing their health insurance. What provisions do you have to ensure that a person moving to another employer who has a group plan, not an individual plan discounted by volume, two different things, has a group plan, can refuse to cover that person?
Yes, Regulation 7 of the Health Insurance Regulations 2013 revision does require an approved insurer to accept the cover for that individual. And as a matter of fact, it provides the details in regards to what level of benefits. In other words, if you're moving from company A to company B, right, and there was no break in coverage that exceeded 60 days, that approved insurer for that new employer must accept the coverage, and they must provide a similar, may not be the exact similar benefit plan, but at least a similar benefit plan to what they had with the previous employer.
So insurance companies and employers can no longer simply reject people because of their risk and tell them if they get rejected by two companies, they can become a ward of the government on a cynical.
That is no longer certainly, legal under the legislation.
Any further questions, Mr. Miller?
Not on insurance, but going back to the regulation side of it. The other question I asked was, the health practice law allows for 3 types of license, particular for doctors, one of which is an institutional license. Has any doctors, will we just stick with one profession because it'll apply across the board, has any doctors been given institutional license, and what institution have they been specified to work at?
Yeah. To the best of the information that I have available, there's only one institution that has certainly met the requirements to obtain their licensed practitioners under that license.
Has the medical practice board, in accordance with the law, identified the institutions from which those people who they would recognize the qualifications from, and you can now give me a list of institutions approved by the board which have allowed you, not you, but you know, I mean the board,
Right.
to license these people from those specific institutions?
Yeah. Do you have a specific institution in which you're referring to, or you're just asking general?
No, I just want to know, has, the law requires, let me get the law right here. The health practice law requires that before the board can license any physician under the institutional group, they have to identify the institutions from which they will accept meaning the universities,
correct.
from which they will accept qualifications, right? Here's what the law says. An applicant shall be eligible for institutional registration and licensure where he is fully registered as a health practitioner in a country other than Australia, Canada, Jamaica, New Zealand, South Africa, United Kingdom, United States of America, and B, he has, 1, obtained qualifications from an institution approved by the relevant council in accordance with guidelines approved by the governor in cabinet and published by council in the Gazette. You say that there have been people who have registered under this institutional section. What institutions the council have approved for these people to get their qualifications come and allow this? Can I have a list of those institutions?
Mr. Chair, through you. We don't have a list of institutions available. The applications were considered in accordance with the guidelines that were approved by Cabinet and gazetted, which outlined, for example, for the Medical Council, one of the sort of credentialing agencies they could refer to was the Avicenna Index, which is used by the Council in the UK. I can't remember, I don't have the guidelines in front of me, but they don't list specific institutions like the University of West, whatever. They're guidelines that the councils use when they're considering those applications. If the member wants us to get a list of the actual educational institutions of the practitioners who have been registered under the institutional category, we can undertake to get that to you.
But, through you, Mr. Chairman, you're saying that the governor and cabinet published guidelines. That's part of B. The first part is they obtain qualifications from an institution approved by the relevant council. So the question is, how can you license a physician under the institution, any institution, anywhere in the world, who got qualifications unless the qualifications was approved prior to licensure by the council?
Mr. Chair. Sure. The act of considering the applications by the councils, they've evaluated the qualifications that have been submitted by the applicants in accordance with those guidelines that they have to guide them, and made the determination based on those that the qualifications the applicants have presented have or have not satisfied them for the purposes of registration.
So you are suggesting that Cabinet has issued guidelines which overrule the provisions of the law? And you have licensed people without meeting the first provision of this section of the law?
No, sorry, that's not what I'm saying. The guidelines are gazetted by Cabinet for the councils for two reasons. They're gazetted so that they're out there for applicants to be aware of them, so that they know the playing field that they're playing on in terms of what will be considered, and so that the councils have clearly outlined or have clear guidelines that they will use. The guidelines vary from council to council. Each council has slightly different guidelines because the credentialing agencies that are used vary depending on the area of practice. So the guidelines are what are utilized by the council to help them make the determination to satisfy themselves whether or not the applicants are appropriately educated. And they were formulated in consultation with the councils at the time.
So,
Microphone.
Yeah, I think it's fair to say, Mr. Chairman, that those guidelines were developed in consultation with the councils. And certainly the registrar then does the due diligence in regards to the applications in supporting the councils in making the decisions in regards to that application.
I get back to the original question. How does the council and how does the guidelines override the requirement in the law that the applications must be obtained from an institution approved by the relevant council?
Mr. Chair, the guidelines are intended to assist the councils in making that decision to approve the institution that the applicant has presented. So if, for example, the applicant presents that they have qualified at, the University of Toronto, although Canada is one of the jurisdictions we recognize, but then the council would look at the credentialing agency that they have identified in their guidelines and find out whether the degree from that university is one that they believe is adequate, is appropriate, and is recognized. So it's not, the guidelines do not supersede the requirement that the council approve the institution. They're what the council uses when making the determination regarding the institution that the applicant was educated at.
So, the council has gone to the trouble for Caymanians who want to be fully registered to specify the countries from which they will accept registration for Caymanians. But for this institutional registration, there is some arbitrary guidelines that says they can accept any institution anywhere in the world if they believe it fits into this criteria. They don't have to the institutions don't have to be pre-approved. The person can apply from anywhere, and if the council decide that that fits the criteria, he can be licensed as an institutional physician.
Mr. Chair, the institutional registration category was set up to allow for particular health care institutions in the Cayman Islands to be designated by Cabinet as eligible to have institutionally registered practitioners, and to allow for practitioners from jurisdictions other than the 7 that we recognized previously and that we still recognize on the principal list to be registered. One of the big challenges that was faced, and obviously the genesis of this was the Health City project, Dr. Shetty's project, but it also came up in discussions regarding practitioners from other countries besides India and how we could facilitate bringing practitioners here from jurisdictions that we didn't currently recognize without adding that country to the list, so to speak. For example, the Nursing Council believed, when we were doing the discussions and the review of the law, the Nursing Council said that the nurses from Chile are very well trained and very well qualified, and they'd be quite happy to bring them here. But the dentists and the doctors didn't necessarily share that view, so there would be concerns with just adding Chile to the list. Whereas the way that the law has been crafted is to facilitate considering applicants from other countries. And the principal list, the 7 countries on the principal list, we've effectively said if you're registered with their medical, with their councils, whichever the profession is, we are confident that you've been appropriately vetted by those councils. If you meet their requirements, you're fine for us. So we, for example, don't have a list of universities in the UK or Australia that we recognize. We say if you've been registered in these countries, then you've satisfied them and you've satisfied us.
Well, I agree, that's acceptable. That has been the standard until this institution was, that has been the standard until this, unfortunately, lower standard of institutional physicians was introduced. Because they couldn't, and because it was specifically introduced because they couldn't meet the criteria to get registered under our current law. There was no other reason to do it.
Mr. Chair.
Mr. Miller, in all fairness, I don't think
That's my view.
why they can answer to a certain extent. I do believe that happened in a previous fiscal year and not related to 13-14 or 14-15. So
Agreed.
I would only ask that they answer question in relation to the appropriation at hand.
Okay. So I agree with your rules.
Mr. Chairman, also to add that those individuals are restricted to those institutions.
And it's not a second-class
They
registration.
can't go and leave there and go and practice. And it's not a second-class registration at all.
You're entitled to your view and I'm entitled to mine.
Is there further questions?
Oh, yeah, plenty of them. Why has not the medical council, in the period between when this was made law, identified and approved these institutions?
I didn't follow the question. I don't
Question
think
is,
I don't think they did as well.
This law was put in place in 2012. Right? It's been over almost 2 years. The question I'm asking is, from the regulatory side, why wasn't an attempt made during that period of time to come up with these approved institutions from which people could be licensed?
Mr. Chair, I'm not sure if you're quite following because we couldn't, first of all, we didn't want to add to the 7 approved nations that exist. The guidelines are fluid and takes each case on its merit. It's not a case where you could list institutions like, universities and all that. So each case is vetted on its own merit and based on the accreditation that's provided. So that's all I can tell a member in this case.
Can the minister say if that the current medical council in issuing these institutional licenses done it willingly, or is there a protest letter on record objecting to have to do it that way?
There was, through you, Mr. Chairman, there was a lot of discussion on this topic, and there were letters written and reservations expressed. But at the end of the day, I think it's safe to say that the councils saw the wisdom in what was trying to be achieved, and basically agreed to to disagree on some elements and followed the guidelines as laid down by Cabinet. It could have resulted in a breach of agreement with serious repercussions for government if you had not.
You don't want to go down that road. Because what you just confirmed to me that you were more concerned about the breach of the MOU than you were with licensing the right professionals. And I'm very worried about that.
No, not at all. That also was a consideration, but it wasn't the primary consideration. The most important thing is that you have people practicing here at the highest standard possible, and I think that the people that are investing the money that they did up at Health City certainly have a reputation to uphold, and they're not bringing people who are not meeting the criteria, and the councils have satisfied themselves, and due diligence has been done, and it's quite clear that the people that they are approving are people worthy of being approved.
You said it wouldn't bring people that weren't. Is there any instance in which they applied for people that a license was denied?
Yes.
Well then, I would suggest that they have tried to bring in some people that couldn't make the grade.
That's debatable too, because
But if you
it's for
couldn't license
different reasons.
Huh?
For different reasons. In some cases, it might have been that the experience level or something that didn't quite meet what was required.
All right. On the 13th of December 2013, Cabinet issued a health practice designation healthcare facilities order to Health City Cayman Islands. What criteria was used to issue this order?
Through you. At the time, the requirements were, you're referring to the designation as a facility eligible for institutionally registered practitioners? Okay, I'm pretty sure that's the designation for the institutional eligibility. The sort of criteria or the sort of things that would have been considered in that was the requirement that they comply with all the requisite legislative requirements for their healthcare facility, that the Cabinet believed that it was in the public interest to allow this institution to have institutionally registered practitioners, that the institution had presented a case for why they wanted to have that designation applied to them.
Did the facility that was so designated have a provisional occupancy certificate at the time?
Through you, Mr. Chair, I don't believe so. I don't believe that they would have had it at that time. I don't think they had reached substantive completion of their construction yet.
Did it have a healthcare facility license that is approved, that is also required under the law?
No, it wouldn't have done because they weren't at a point of commencing operations.
Don't you think it's a little bit strange that you would designate a facility when you have no idea whether it's complied with the planning law, whether it's going to comply with the planning law, or whether it's going to be licensed as a facility?
Mr. Chair, through you, the requirement or rather the designation facilitates the facility making applications for registration of their practitioners. Obviously, the councils would not be able to approve those registrations and licenses if the facility was not appropriately licensed by the Health Practice Commission as a healthcare facility. And the requirements for it to be licensed by the HPC include meeting the planning requirements for a certificate of occupancy, and the other due diligence requirements that go into it. So the designation by Cabinet really just facilitates the facility being able to make those applications, and it doesn't mean, if, for example, in this case, subsequent to that designation, the facility had never commenced business or it never had received its Health Practice Commission certificate to operate, the practitioners couldn't have been registered regardless of whether it had been designated as an institutionally eligible facility or not. The designation is really part of the oversight that was put into the law so that there would be some consideration given as to when this sort of designation was going to be applied and available and who would be able to access it.
Has the designation under 7A been issued? Pardon?
I'm sorry, I don't have my law in front of me, so is that the medical tourism provider designation? Yes, they, sorry, Mr. Chair, through you, they have received their designation as a medical tourism provider.
When was it gazetted?
I don't have that. I can get that for you. I can provide you a copy with the Gazette.
Mr. Miller, is there another question? Or no? Are there any other questions with respect to this appropriation? No further questions? Mr. McLean, you have a question, sir?
I wanted to ask a question, but I don't know if it's further on where doctors coming to HSA and then being registered in the private practice, because it appears like everybody and their brother and sister use us as stepping stones, and what policy there was on that. But no, I don't.
Just ask the question, sir, and if we can answer it, I'm sure they will.
What is the policy on doctors coming to work for government and within short periods of being at government, then go out in private practice and set up their own businesses?
Through you, Mr. Chairman, to the member, doctors coming here have to be affiliated with a facility. So it boils down to more of an immigration matter at the end of the day, because there's no policy per se from the HSA on that. So a doctor comes here, works, registers with the HSA, works with them for time, and then gets an offer in the private sector, and it's then a matter of a permit through the immigration department for that person to move.
So what? That how it works?
Yeah, they're affiliated.
You mean we got free fall in Cayman or what?
No, but they have to be affiliated with an institution.
But they are with government, aren't they, while they are? Is that would be the affiliation?
No, but then they would move to another, they wouldn't be affiliated with government still and move, they have to resign with government and move to the private sector.
So you're saying that another institution in the country would have
Another
to take
healthcare
them on,
institution,
but
becomes an immigration issue.
so So how come they're practicing on their own? What kind of institution is that they're affiliated with? Or maybe I'm getting it wrong. Are you considering institutions such as Krista Tomlinson, Shetty?
Yes, that's what I'm referring to.
So how are they setting them up private then? The small little offices? FRONTIN.
Again, that goes back to the immigration side of things with a Caymanian partner, and that's not an HSA policy issue after that.
No, well, it is from the beginning.
In the beginning.
Yeah. And I'm asking, what is the policy on that? On doctors coming to work for the HSA on the government contract, what restrictions are placed on them? Because 90% of them are complained about while at the government, then they go in the private sector and become multi-millionaires.
Mr. McLean, are you asking if the actual contracts contain a provision that...
Yes, to prevent them.
Right, that's what I gather he's asking. I'd have to ask hang on, sir.
Just stop it, man. They have to stop it. Everybody come here, and our doctors not gonna have no way to go. Because I don't know how they can get the money. And we got doctors here who can't get the money.
Mr. Chairman, through you. It's pretty much as I said before. Once they come here and they're on the contract with the HSA and they resign from the HSA, there's no restrictions, non-compete or any prohibitive clauses in the contract. They go on and they end up in a business arrangement with a local situation, and they then act as the practicing physician on the immigration. So that's the way it works at the moment.
Thank you, Mr. Chairman. May I just ask the Minister, in light of the fact that we are more and more Caymanians are becoming MDs, I heard somewhere that there's some 15 or 20 that is currently at some stage getting ready to come home in the next 6-7 years, anyhow. In view of that, can the government consider putting in, HSA that is, non-compete clauses in these contracts so that people can go back to their point of origin and them young doctors can take up their rightful place in this private sector?
Mr. Chairman, I think the member has a very valid point. We were not in this position forever in Cayman. We are just now seeing the advent of many Caymanian doctors, and at the end of this year, we have quite a number coming home. So it's something that we will take on board, and I'm sure the CEO and will pass that on to her management team and look at that going forward. But it's something worthy to note because we certainly need to have some avenues open to our young people when they come home.
Just a question of my own. Just a question of my own. Given that there are no restraint of trade clauses in the contract, do we assist doctors in moving to the country when we hire them at the HSA? And is there a
The answer is yes, Mr. Chairman.
Thank you. Is there a time within which they are required to, or is there a time for them to remain with the HSA or repay the expense of those moving costs?
There is usually a 3 or 5 year contract, yes.
Okay,
Yeah.
fair enough. Mr. Miller, you had a question?
Going back to the institutional license, I think the regulations say that an institutional license is only good for 2 years and it can only be reviewed twice. Is that being overridden by the MOU for Health City?
Mr. Chairman, through you, not to my knowledge, no, sir.
The health facilities license, not the designation. The health facilities license, I think, is a 3-year license. Is that overridden by the MOU with Health City?
No, Mr. Chairman.
Thank you. Mr. McLean, you were trying to ask a question?
Mr. Chairman, it's a question that may very well extend into a number of things because it is about people being referrals. Because of my experiences recently with constituents and the delay therein.
223.
Mr. Chairman, through you to the member, I think that is going to be more of a cynical-related question.
No, you in it too.
He hasn't yet asked the
We'll
question.
deal with it under indigence.
Okay.
I given the finance minister a break.
Okay.
You got deal with something.
All right, sir.
Thank you. If there are no further questions, we will proceed to vote on this particular appropriation. So all those in favor of HES 2, Health Regulatory Services for $1,024,583, standing part of the schedule to the bill, please say aye.
Aye.
Those against, no. We are discussing appropriations to the Minister of Health, Sports, Youth and Culture. Looking at appropriation HES 4, Sports, Coaching and Training Programs for $3,813,866, found on page 216 of the annual plan and estimates. Are there any questions? HES 4 Sports, Coaching and Training Programs for $3,813,866 on page 216. Are there any questions? Mr. McLean?
Mr. Chairman, I wonder if the minister can tell me, when there were plans to build changing rooms at the East End playing field. Can the minister tell me if those are still in the works? Or when they will be built?
It is not in the current capital budget or the upcoming one, and it's simply because it's a matter of resources in regards to what hit us with the CONCACAF events. We've had to do so many upgrades, both at the Annex and West Bay. West Bay is our current nearing completion for the Under 15 tournament, and Georgetown Annex still has to be done. So we got, and of course there were a lot of improvements that had to be done at the Truman Bodden complex. So we spent millions of dollars in this past year getting up to speed to host these tournaments, which were seen as very important for the economy and the development of football. So those changing rooms for East End and anywhere else, Bodden Town for that matter, would need to be looked at in the coming budgets. And I will undertake to, once we've gotten this pressure off us in the 15-16 budget, to certainly look at getting them done.
Mr. Chairman, can the minister then tell us why we go and spend all that Cayman BRAC on that? Up there just to host 2 games?
No, in relation to the BRAC, Mr. Chairman, I think that it is safe to say that what is being done in the BRAC is not just for the hosting of the 2 games, but we're looking at creating a sports park, as it were, on that site. And this is all part of that development. So it's everything that's going on there. Maybe eventually even a pool will go on that site. We would like to see that as a place where the folks in the BRAC have, as when sports events are happening in the BRAC, that is their mecca, as it were, to go to. So they were needed certainly for the tournament to be held there, or for the section of the tournament, this upcoming tournament, to be held there. But they're not going to be, as it were, just thrown aside once that tournament moves on.
Mr. Chairman, I wonder if the minister can tell us if East End, Northside, and Bodden Town would qualify with the high standard facilities we have for matches during these under 15 games.
The venues were chosen basically Truman Bodden, Georgetown, Annex, West Bay, and now the Brock. And the infrastructure that's been put into each of those, we really don't have in the three eastern districts, because there's a certain, for instance, a good example is lighting. We do not have the degree of lighting, the 800 lutes or whatever it is that is required. We don't have that on those pitches. There's no reason why the pitch itself in each of those districts are you know, it's not to say that the pitches were probably not up to standard, but we couldn't have matches, and it just was going to cost a lot more. We had to look at what best we had, the setters that we could use, the ones that were nearest to what we needed, and go with that. So that's the way they were chosen, really. In future, as future tournaments come along, I would like to think that we can spread it out and do games in all of the districts. But we're getting started in this, and we had to start somewhere. And we started with at the Annex, which is the Mecca of football in Cayman, Truman Bodden, which is our national stadium, West Bay, which has an artificial turf, and also population centers as well. So we had to look at the big picture, and these were the recommendations through CIFA and CONCACAF as we were looking and moving along.
Mr. Chairman, I appreciate the answer the minister gave me, because there's always a method to Arden's madness. Now here comes the big one as you walk in this one. CONCACAF wouldn't qualify the Eastern Districts, but Bodden Town is the national champion. How do we expect them up on the Eastern District to develop if we cannot get the facilities up to greater standards? With Cayman Brack not even having a team in the nationals of this country, but the one district that became champion twice with the poor facilities, and we doing nothing to upgrade them.
Mr. Chairman, I think we're talking apples and oranges. We're talking about hosting tournaments which require a certain amount of seating, lighting, facilities such as changing rooms and the like. The government had to minimize the expenditure to host these events. In the Eastern Districts, we lack a lot of, we have a basic field, a little stand, and some lights. And of course, we have natural talent in Bodden Town. Nobody's proud of Bodden Town because that's my team. I used to play for it for 20 years. So they've won 2 years, and that's commendable. And that can be achieved in any grass piece, because what you need is a good coach and players and a ball and technical expertise. But when it comes to hosting a tournament, that's a whole different matter.
Mr. Chairman, I know that's a whole different matter. I understand it's a whole different matter, but I am saying those, even through the challenges that they have had to go through on those little fields, and now we are still forgotten up that way, and the facilities, especially East End. I don't know when the minister went there last. I would invite him to come, but the pitch is as bad as it is in Bodden Town, down by the school where his team practices. The lighting is poor. It's half of the time the bulbs are out, and this is maintenance, and nobody's maintaining that. I don't know who is hired to do the maintenance. I would also like to ask the minister, whoever it is responsible, ask them to turn the lights off in the day that God gave us that bright sun upstop there. because that's a waste of money. That is Bodden Town and East End. Whoever it is responsible for these fields are not turning off the light. I've been complaining about this for 2 years. We could have paid what we paid CUC and electricity bill. We could have fixed up both of those fields.
Thank you, Mr. Miller. Mr. McLean, sorry.
Thank you, Mr. Chairman. And the member's concerns are valid, and he knows that I know. I would certainly like to visit with him on the East End field. It's been a while since I've been on that field. I won't lie. I've been in the vicinity, but I haven't been on the field. And I know that there's some things that there's some fencing, there's lighting, and there's field upgrades that need to be done there. And we certainly will be looking at getting all that done. The field maintenance has just been retendered and retendered, and a new maintenance operation taken over that, and we're looking forward to seeing an improvement in the actual maintenance of our fields, because what happened when we were here in government last, everyone knows that the PPM government spent a tremendous amount of money on infrastructure after Hurricane Ivan, and in particular with our sporting venues, from the national stadium right through to all of the other field upgrades. And they were all well grassed, and we had a lot of nice Bermuda grass, and that grass is high maintenance. And sadly, it was not well maintained, and we ended up now with, we have one field, the Bodden Town field actually, which is well grassed now, because when I got in and saw the state of disrepair that I was in, I made some noise, and the contractor at the time actually closed the field down and did it over. That is actually in quite fairly good shape now, and the stadium, that is the Truman Bodden field, is actually in pretty good shape. Apart from that, the rest of the fields are real. Thank God we have AstroTurf in West Bay and Georgetown, but otherwise the fields are really not in the best of shape. I think the north side one isn't too bad, but I know Bush is taking it over. It's a very gentle, tender grass, and
Lona grass stumps.
if you don't maintain it, sadly, like anything that you don't maintain, whether it's equipment, grass, or buildings, you're going to have problems. So we have a lot to do in that area, and I'm not shirking that, but we've been very, very busy and really consumed with getting these facilities up for these tournaments. Once this is out of the way, we can get back to the basic maintenance of what we need to do and move the Eastern District fields forward and hopefully improve lighting and improve facilities at them. Thank you.
Mr. Chairman, another question on this. Can the minister detail for us the school sessions and programs conducted at East End School? That is coaching. And you don't say at the same time, so save yourself the question.
Yes, sir. Yes, sir. I'm calling my director up, and he will be happy to assist. Mr. Chairman, just bear with us, please. This is the hot seat. I think you better use that one, otherwise I'll fall off. I introduce myself first.
Okay. Mr. Chair, Colin Anglin, Director of Sports. In relation to the question, we have 4, you would say, district football coaches, sports instructors. One of them is positioned in West Bay. One is in Georgetown. One is in Bodden Town, and we have one for East End. In relation to school sessions with East End and North Side, we communicate. We actually had where our sports instructor had to communicate with the principals about making themselves available. The Department of Education, the Ministry of Education, through the Department of Education, has Mr. Roach, who also goes between those two. Assistance was offered, and as we are asked to come in, then that particular instructor then will do our best to assist in that respect. Primarily, what you find in terms of the Eastern District is more of an after-school program. That is the primary target. But specifically, we reached out to the principals and said, how can we assist? Let us know when we can assist, etc. And based on the feedback, we go from there.
Mr. Chairman, I would ask the minister then, there are exceptions to the rules here. Because I know no one goes to the school in East End. I don't know about Northside. I know Mr. Roach from the Minister for Education Ministry or wherever Education Department is there. I think it's a couple of days out of the week. I can't remember right now. I know the coach under the National Coaching Program goes up in the evening and spend time, sometime the young man from West Bay, I don't remember his name, Dion, at the football field that got a Luna grass stumps. He is there, but there is no national involvement at our schools, at the East End School. And I need to know, if we're spending all this money on coaching our children, when will we see a permanent coach, or that permanent coach being a part, that coach being a permanent part of coaching in the East End School at the early age? Because Mr. Roach, no football coach.
Mr. McLean, is this a question for the sports ministry or the education ministry? If you're asking for that member to be a permanent member, for that person to be a permanent member of staff, is that something that the sports ministry would do, or the education ministry?
No, Mr. Chairman, I'm not asking for it to be a permanent member of staff. A permanent part of the coaching, the national coach, be a part of the school. Yeah, not on the staff, but in conjunction with the education, that is where the national coaching should start, in the schools.
Mr. Chair, could I? Through you, sir. We're definitely looking at a much broader picture. For one, we, as the Department of Sports, can never dictate how often or how much our staff can go into the school and coach. That is completely determined by the Ministry of Education. Some initiatives that we've really been working on, because we do recognize the importance of such things, especially at the grassroots level, are really establishing proper inter-school sports. Our the football instructor, based on our staffing, we don't have enough coaches right now that every single one can be assigned to each district for each of the focus sports. Football is the one that we have the most coaches in. However, for that instructor to be able to come in, that would still only dictate a certain period of time that they would actually be able to help for what would be a season for the school. Ultimately, we don't want a situation where all the kids do is play football all year. Of course, we want to expose them to a number of different sports. And that's why we're putting an emphasis on establishing a proper structure with seasons that these kids can get exposed to a minimum of the 6 focus sports, each year. So with that, with the way that we'd like to really do this, and we're actually planning on sitting down with many of the principals to actually try to get this rolling out for next year, that every single kid can at least have the opportunity to choose at least 3 sports throughout the year, because that would basically mean you're running 2 particular sports seasons per semester or per term, right? So it's about a bigger structure that we're trying to do, but in terms of how often one of our members of staff can actually go into the schools, we can never force that. That's based on how much we're allowed to go in there.
Mr. Chairman, with all due respect, I'm not asking forcing themselves on anyone. I'm asking coordination of themselves in order that we can have a robust program, netball, and I only use football, netball for the young ladies, basketball, whatever the disciplines that you all are dealing with. Is Ms. Martha working with this section?
Mr. McLean, I think he has stated that it is their intention to try to get more sports in there. And we have established that it will require some collaboration between the two ministries. So I think to question him any further on this particular point wouldn't achieve much more.
But Mr. Chairman, I hear you, sir, and I respect what you're saying, sir. But we have had the lack of coaching in East End since Christ won Rivera Beach. And every year they tell us they're doing it next year. That's the problem. And this year will fall into next year, and the next one will fall in next year, and all those primary school children will be inside here as members of parliament before anything is done. That's what happened with me.
Can we have an undertaking that
Yes.
this is something that will be done this
Mr. Chairman,
this coming fiscal year?
this weakness has been recognized, and myself and the Minister of Education, we've talked about it. We've talked about the importance of impressing on teachers and people in the education system that the importance of sports. At the same time, it cannot be to the detriment of academics, but it's an integral part of, it should be an integral part of the school curriculum. That having been said, we have then said we're looking more at interscholastic sports, intersecondary in particular, because we've done fairly well with interprimary. And all of the focus sports, we have to look at the PE teachers we hire. We have to make sure that the focus sports are being taught, are being pushed, and anything else on top of that. But the 6 focus sports, that is football, cricket, netball, basketball, track, and swimming. Got them right? Those are all, we should leave our school system being proficient in those. That's the goal. And if the Eastern districts have been left out in the past, I can assure you that is about to change.
Thank you, Minister.
Mr. Chairman, I appreciate the member. The only sports and swimming and the likes that the Eastern School gets is at the private, the dive place up there. Ocean Frontiers. That's what we have been doing. And there's no government people there with us. And, meanwhile, when Conda used to kick milk can down the street, it only changed the color now. It's Coke cans they're kicking down the street now. It is the same thing for the last 40 years and nobody doing anything about it.
This is why, with respect, Mr. Chairman, this is why the pool was built at the Clifton Hutter High School. And it should not be. So again, it goes back to the coordination between ministries and ensuring that we are working towards the same goals.
Thank you. Thank you. I have 3 questions or 3 members wanted to ask questions. The order in which I saw was Mr. Bush. Are you giving way to Mr. Miller? Okay, following Mr. Miller, then Mr. Eden, and then we'll come back to Mr. Bush. Mr. Miller?
The minister mentioned the millions of dollars that we're spending to prepare for these CONFCACAF tournament. Does CONFCACAF make it any contribution to any of this preparation?
Infrastructure-wise, we, the government, bear those costs. CONCACAF funds all of the tournament. There's a whole heap of expense associated with the tournament that they fund. And hopefully, the proof is in the economy being boosted by these events that are held here. The exposure that's given to the Cayman Islands, it's sports tourism, and hopefully we will benefit, if not immediately, certainly down the road from all of these events that we are doing. And the developmental aspects of it sure paying dividends, because we saw the success of the under 15 boys last year, and a lot of them have gone on to be scouted and doing really well. And we have the girls coming up. Hopefully the same result will take place. We had the under 20 World Cup qualifier here in January, female. That, of course, Cayman was way down in terms of pedigree, in terms of playing and competing with the nature of competition that we saw here, but certainly was fantastic exposure, and the television exposure for that was phenomenal. So it's all to do with government looking for not just immediate returns, but long-term returns on investment.
Through you, Mr. Chairman, I think when you had one of the tournaments last year, the Northside field was taken over by CIFA, and the activities that the district had there were prohibited because they were using it as a practice field. Is that likely to happen now again in this upcoming tournament?
Well, if it happens, it should be done in a respectful way, and it should be done with good advance notice. I don't get involved directly with that. CIFA should know to do things properly. I will ensure that I send an email to that effect, and assure you that it will be done in a proper manner.
Through you, Mr. Chairman, I wonder if the Director of Sports would put together a proposal for the 6 sports that you think should be in place in Northside School, and give me the opportunity to get it done once you give me your professional advice of what you think needs to be there.
Through you, Mr. Chair. That would be my pleasure, sir.
Mr. Eden?
Yeah, thank you, Mr. Chairman. This was addressing what the honourable member from East End was talking about. But 2 Saturdays ago, my colleague, the leader of the opposition, and I were in West Bay at a huge thing for the primary age school children, sponsored by Maples. I think they call it Grassroots or something. And there were dozens and dozens and dozens of children at all age levels through the primary, and to see the way they were being coached in practice, I felt good about it. And it's not a question. I just wanted to take my hat off to whoever was organising that. It was very well done.
Thank you, Mr. Eden. Mr. Bush, you have a question, sir?
Chairman, just a quick comment on that. Just to add to that, there are a number of these grassroots programs. The Maples one is the biggest one, and we have another one, and they do tremendous work. And in fact, I think that it's safe to say they are carrying the junior football at the moment. Extremely good results, and if you go out there and watch the tournaments that they have, they're well organized, extremely well run, and they've even done some of their own international tournaments out of those grassroots because they have so much public support. So that is in addition to all that's going on, there's a lot of really good stuff going on the sports scene. But coordination is definitely needed.
Thank you. Mr. Bush?
The community coaches, are they community coaches? Are they club coaches? Through you, Mr. Chair, sorry.
Testing. Okay. Yes, sir. What we found, and I guess this has come through traditionally, right?
No.
But what we have with our instructors is that for them to deliver a program, you need a certain structure around them, right? You need a certain resources, you need certain volunteers, and what naturally kind of formed to assist these instructors of getting their jobs done and delivering these programs has been the formation of these clubs that have been around them. We know sometimes, of course, that causes some controversy because people think, okay, this coach was hired for this club, when in the reality of it was that the club was really formed to provide a support structure for that coach, because quite often you have the coaches wearing so many different hats that in a proper sports organization, in that kind of setting to run, one person cannot do those things. So they do have that type of structure around them. I guess in a way even kind of similar to, well, I guess in this situation you might be talking about football. You've had situations such as track and field and swimming where clubs were formed really only because it was the proper way to facilitate very talented athletes being able to travel overseas. You had to travel in the form of a club. You couldn't travel in the form of national teams. So there have been certain reasons why you'll find that club structure actually around those coaches.
No further question?
Yes, sir.
Okay.
Why they had to put him? I don't want to challenge you. Through you, Mr. Chair, to the Minister, when these various international organizations are coming here and telling us that they're doing us this big favor of putting tournaments here, competitions here, and when they say we're getting exposed by television, how have we been able to see or to know? Yes, we can see it on our own, but on our television here, but how do we know how much is being seen overseas? Where's the proof in the pudding? Just word of mouth, or do you have it?
Mr. Chairman, it's quite obvious the networks that were brought in here for the Toronto tournament in particular, and I actually went inside of the broadcast trailer and saw the various broadcasts around the world on whether it was Univision or Fox or something else that was showing it. So we know for a fact that these broadcasts were taking place, and they spent a ton of money on importation of all of the expertise and equipment that was needed for that.
Mr. Chair, through you, what are we using as a means of measure to measure what results we're getting from our coaches? Yeah, what results do we have to show?
Which coaches, Mr. Bush?
Coaches in general that are under the government program.
Okay.
Okay, let me address that, and then I'll ask the director to jump in. But the coaches, our national coaches, are now all under the various associations, with the exception of track and field, which is about to go that direction. The cricket, netball, basketball, swimming, they all are hired by the various associations. So it is the association that dictate whether that coach is performing or not. And we see the results, and from my perspective, there are some results I see that I don't like, and there are some I see that I like. I can have a word here and there, but at the end of the day, those coaches are hired, and although it's paid through government grants in a lot of cases through the association, but the contract is with the association, and the association has a board, and that association should know whether they are getting the right results from that coach.
Thank you, Mr. Chairman. My last question on this section. When these recommendations are made from these international organizations about what they need and what they want and so forth, who in our ministry has the expertise to understand what they're talking about? Where's the technical expertise in our ministry beside the director of sports?
We have the director of sports, and we have the sports senior advisor, Mr. Francis. We have also, we look at it as a ministry, and we decide what we do going forward with the assistance of the director and his team. Whether as a government, we first have to decide whether the expenditure makes sense. And right now, we are a case in point. We are looking at the bid, for instance, for the 2017 Beach World Cup tournament. But it comes at a high price, and we have to decide as a government whether that price is worth it. So we have to decide whether the investments that we are making when it comes to CONCACAF or any other organization is worth it. At the end of the day, we don't want to be in a situation where we've seen around the world where oftentimes white elephants are built or expenditures incurred that you know on earth you're going to recoup. We have to be careful, especially in these stringent economic times and tight budget restraints. We are very, very careful.
And my last question. Mr. Francis, what's his qualifications in sports? That's it, Mr. Chairman. On this section. He hasn't done. Not one qualification. Radio announcer.
Mr. Francis is a university graduate. He has been in the ministry from 2005, and therefore he was an avid sports fan always. He's he's gone off on various courses here and there. He's not trained in any special expertise when it comes to sports, but I think suffice it to say that he looks at things in terms of the analytical perspective very well from what I've seen since I've been there, and he puts forward proposals or non-proposals and says, well, this can't work or this can work, Minister. This is my recommendation. That's his job. So he looks at it basically from a business point of view as to whether this makes sense, and he has a good understanding of the sports that we're working with. I think it's suffice it to say that he has a very good understanding of all of the sports. He's not a coach. He's not a manager of. He hasn't been involved in dealing with sports teams and all that on the ground. But you know, he's a person who has a very keen interest in what he's doing, and I think his experience in the last 9 years has put him in pretty good stead in terms of offering advice in terms of what makes sense and the direction and the policy. He's very good at carrying out policy, and that's the important thing. The policy of the government is to go in a certain direction. His job is to ensure that that's done, and not necessarily, you don't have to know how to fix the car, but if you can know the end result that you want from it, then that's what you want, and that's his job.
Mr. Chairman, could I ask you to ask the chief, through you to the chief officer, that if you could have supplied to us, since she was the one advising the minister on what courses or whatever he's been off to help us look at who's helping us with our policy and so forth, and what I can tell young people what they have to do to aspire to that post in the future. So could I have a list of the things that he's attended to help him attain this level where he's at, please? Thank you.
Mr. Chair, I'd be happy to provide the job description for the Senior Policy Advisor for Sports. To
No,
the member.
Mr. Chairman, through you. I never asked for no job description. I have the job description. What I want is what this individual that holds the post, they said that he's been to various courses or something that they use. I looked in the hands and get the exact word. I want to know what those things where he attended, so I can let young people coming out of college know where they have to attend to aspire to this post.
I think he's asking for the various training courses that he's attended that would have enabled him to acquire the skills that you say he has. I think that is the gist of the question, but we will not spend any more time on that. If we could move on to another question. Having said that, he did ask for it. Are you able to provide that? Not immediately, but at some time.
Yeah, I can certainly give the member a list of the workshops and courses.
Thank you, ma'am. Thank you. Mr. Suku, you indicated that you had a question.
Thank you, Mr. Chairman. Just through you, could the minister state what sports does the Cayman Islands have regional and international representation currently? In what sports?
Sir, can you be more specific? That is a very broad...
Just what sports are we represented in not outside the Cayman Islands, not just locally, but regionally and internationally?
You mean in various tournaments?
Yeah, not tournaments, sports at a level beyond local competition.
I think you may have to refine the question because they're as puzzled as I am, so...
Just trying to find out, sorry. Yeah, what level of participation and in what sports?
It's quite a range, and I would have to gather that really from the various associations, Olympic Committee, and the Athletic Association, and the like as to what. But I mean, I think what the members alluding to are sports like boxing, that kind of stuff, boxing, a range of athletics that we really don't do here, and what else? I mean, let's use the Island Games for an example. We did so much there. We did shooting, cycling, archery, rugby, squash, badminton. The list goes on. Volleyball. I mean, some of these sports are played locally at a certain level, but to be honest, to excel and to get to that other level is really overseas participation, and it's when our young people really go off to college that they start to really get into the various degrees of and improve quite dramatically. Did that answer the question?
Mr. Sukul? It did? Okay.
Well, we can provide a full list and write into the member if he wishes.
Are there any further questions on this appropriation? If there are no further questions, all those in favor of HES 4?
Mr. Chairman,
Hey, Mr. Bush.
you're moving on from the sports director.
We are on HES 4.
All right. Okay, Mr. Chairman. I didn't want no questions. I was just going to congratulate him
Okay, well,
and thank him.
proceed to do so.
Well, that's all I want to do, Mr. Chairman. Mr. Chairman, we can sit here all day and ask all kind of questions. What we do have to recognize is just how far we have come. All of us in my age group will remember we had nothing. You're talking about playing in a grass piece. We kick more stones and barefoot. And we played more cricket on the street. That's why there was no traffic, so we could play on the street. We never had anything. And I am very proud of how far we've come. I'm very proud to be one that initiated the policy that still exists of the mean sports that we do now have. And the facilities that had to be upgraded. But we've come a long way. And as that advertisement say of Marlboro, we've come a long way, baby. For those of us that remember.
Thank you, Mr. Bush.
And I do want to thank the sports director for the work that he do, and the staff. And then we imagine under trying circumstances, because we don't have the funds now. The funds have to be shared around everywhere, including travel and entertainment.
Thank you. We'll proceed.
So, Mr. Chairman, I am one legislator who will go on the record and say that I want to thank the government for continuing, in fact, the sports for all policy, and in fact, sports tourism and moving forward in sports tourism.
Thank you. We'll proceed to the vote. All those in favor of HES 4 sports coaching and training programs for $3,813,866 standing part of the schedule to the bill, please say aye.
Aye.
Those against, no. Before we consider the next appropriation, I'll just make the announcement that we will be taking a mid-afternoon break at 4:30 p.m. And when we come back from the break, we will be working until 7 p.m. this evening. So just to give everyone time to put their matters. That's up to you all. So we will be working until 7 p.m. this evening. So just for visiting civil servants to inform anyone that they may have to inform that you'll be here until such time. Considering now appropriation HES 5, youth education, mentorship, and community activities for $636,703 on page 217, 217 of the AP&E. Are there any questions? Mr. Miller?
To you, Mr. Chairman, I wonder if I could have some information on the summer camps and when they're likely to be taking place in Northside.
Yeah. I'm going to ask the director, because these are mostly sports camps that are taking place in the districts. So the director will answer that question.
Through you, Mr. Chair. In regards to our sports camps in the eastern districts, what we've traditionally had, of course, is normally we do a range of football camps through August, especially, right? Primarily, it was football camps. The difficulty that we've run into now, well, this time around, because of the CONCACAF tournament as well, which will be running for the greater part of August, that's created some difficulty in terms of our provision for Northside and East End. I'm actually still currently trying to work something out, but we had to go ahead and publish what we could go ahead and do right now. That information is actually on our website, departmentofsports.com. But just to let you know, sir, that it is something that we're trying to find a solution to, because right after the CONCACAF tournament is done, then you have school pretty much starting there, and because of the rules, so to speak, of the competition, that's what kind of puts the field or the facility. We have to put it under the control, so to speak, of CIFA while this tournament is happening, simply because of the tournament guidelines that happen.
So you can't have a football camp in Northside because the Northside field is going to be under control of CIFA during the month of August, or July and August. This CONCACAF business, and we're not getting none out of that.
Well, that creates a difficulty for actually, all of the districts is what we've had, but we are trying to find a solution for what else we can do. In terms of football, it's going to be extremely difficult for that period, but we are really looking at finding some other options available for the eastern districts.
Would you consider dancing a sport?
Dancing is considered a sport.
Okay,
sir.
we can talk. I got a program we can help with, and I think we should be able to do some swimming camps for Northside and East End at the Clifton Hutter High School, which would be closed.
Sure.
But the problem we've had now with the after-school program with kids swimming is that it's a $25 per hour charge for the child. And there are many single families in my constituency that can't afford that. Huh? I think it's the after-school program themselves. But it's if a Northside child in the after-school program wants to go to Clifton Hutter for swimming lessons, it's $25 per hour.
Through you, Mr. Chair, that arrangement is not made through the Department of Sports. I do believe that is through one of the private swim clubs that's actually providing a program over there. Is it $25 per session, or is it per term? I'm not.
My understanding is the information I was given was it's $25 per hour. I could be wrong, but that was. But you're saying that the government is allowing private swimming people to come up and utilize the Clifton Hutter swimming pool when the community hasn't been given access to it? What are you charging these?
That facility doesn't fall under our control, sir.
But getting back into the original question, would you be interested in under this vote, sponsoring, help assisting with a dance and art program, and maybe we can put together a swimming program free for those children, maybe for a week or 2 weeks during the summer?
Through you, Mr. Chair, I would certainly be willing to sit down and look through this with you, sir, to try to find as many solutions as we possibly can. Yes, definitely. Okay.
we have gone as far as to make arrangements with the Fred Asseter School of Dance to bring in coaches and stuff. So it's a very high-level program, and it's actually been ongoing from the second week in February. So preparing for that, but we have a 2-week period in the summer in June. Anyway, I'll write your proposal.
Yes, sir. No problem.
Mr. Chairman, I'd just like to say that I guess it is clear to all by now that not only do we suffer from a lack of resources, but we suffer from a lack of time in the calendar year in terms of getting everything in that we need to get in. And a lot of times, scheduling is a real problem for us. And this is why, as I said earlier, coordination, because it really has to flow smoothly for it to work properly. And but certainly we are not, as a ministry and as a government, going to turn down offers like what Mr. Miller is making if we can work them into our scheduling.
Thank you. If there are no further questions on this appropriation, we'll proceed to the vote. So all those in favor of HES 5, Youth Education, Mentorship and Community Activities, $636,703, forming part of the schedule to the bill, please say aye. Aye. Those against, no. HES 7, Collection, Recycling and Disposal of Waste for $3,193,711 on page 218 of the Annual Plan and Estimates. Are there any questions? HES 7, are there any questions?
Mr. Chairman, through you.
Mr. Miller?
There are a number of monitoring wells that were put in place around the solid waste facility in Georgetown, the dump, back in the early 90s. How often are these wells monitored, and what have been the results recently?
I have the director here, and he will assist with answering these questions. The monitoring wells, how often have they been monitored, and what have been the results?
Rodell Carter, Director, Environmental Health. Through you, Mr. Chairman. The wells around the general area of the landfill, we have been monitoring those at least annually for the past several years. And the parameters that we use are similar to the US EPA regulations for such wells. The results and the testing is actually done overseas at an approved laboratory. All of the results so far are within the established parameters of the US EPA.
So the wells and the testing does not support the public claim that there's a whole pile of pollution migrating from the solid waste into the north-south?
The testing does not, Mr. Chair, through you, the testing does not support that. All of the parameters are within the boundaries of the US EPA regulations.
Through you, Mr. Chairman, how often do you collect solid waste in Northside now? And what days of the week they are?
Getting the schedule, one moment.
No problem.
Through you, Mr. Chair, we are currently collecting residential waste once a week on Grand Cayman at this time. The collection day for the eastern zone in north side is on Fridays.
When you say north side, eastern, or the eastern zone, you're talking about the truck that goes through East End, the Queens Highway, or the truck that goes around Point? or both are on Friday?
The north side, the zone that's collected on Friday is basically from Bordentown, from Wilty Drive, Midland Acres, Pease Bay, Frank Sound, North Side District, East End District. All of that is collected on Friday.
Okay.
Mr. Chair, if I would perhaps say what the other collection days are just for, at this time on Mondays is in the West Bay District, starting from the Crystal Harbor to north to West Bay, including the District of West Bay. On Tuesday, we are collecting West Bay Road from Lime 3 Bay to South Church Street, Central, Georgetown area, Shedden Road, Eastern Avenue, Walkers Road, Smith Road, Windsor Park area, and Industrial Park. On Wednesdays, we are collecting South Sound Road, Windsor Park, Crew Road, Red Bay area, Old Crew Road, Prospect, including Marina Drive, Mangrove Drive, Mahogany Drive, Tropical Gardens to Patrick Island. And on Thursday, it would be the Prospect Point Road, Spots area, Savannah Newlands, Hearst Road, Savannah, Lower Valley area, Shamrock to Wilty Drive in Bordentown.
Through you, Mr. Chairman, I noticed that you're not projecting any increase in your infectious waste incineration. You have the same tonnage for next year as last year. Does that take into account the coming on stream of the Health City Hospital?
Mr. Chair, through you, yes, that is a variance in that particular number, but yes, there should be no significant increase. The facility does have an autoclave, and it does have a small on-site incinerator, which basically the pathological waste would be incinerated, and then the ash would be collected and taken to our landfill. So the volumes that I would get would be significantly reduced in comparison to what it would have been. So those numbers, you take that variance into over the next year.
And you put in place the necessary controls and inspections to ensure that their infectious waste is in fact being incinerated. And that can be monitored on a weekly or monthly basis.
Mr. Chairman, yes, those arrangements are in place. The facility also has an on-site environmental health officer whose part of his duties will also be to monitor the on-site facility. When our inspectors go to the site, which we will do periodically, we'll also examine records, etc. And in addition to that, the waste that comes to the landfill will also be monitored.
Thank you. Mr. Miller, Mr. McLean, Mr. Eden was next, and then we'll come to you. Mr. Eden.
Thank you, Mr. Chairman. First of all, I'd like to thank my minister for saving Midland Acres from the next proposed dump. On the timeliness on the HES 7, the second bullet point, twice per week as per current residential collection schedule. This was following on from the honourable member from North Side. Hopefully one of these days we'll get back to that, but I must say that once a week seems to be holding up relatively good in most areas.
Thank you. Mr. McLean.
Thank you, Mr. Chairman. Mr. Chairman, I wonder if someone can explain the tons of waste collected from commercial and residential properties. The difference in it. From one year to the next, that is, Mr. Chairman.
Chair, through you. The variance is an adjustment based on our records. That figure of 39,000 had been a figure that we were taking forward incorrectly over the past few years, so it was an adjustment on the actual numbers using the information from the scale house.
Mr. Chairman, can I then ask where the numbers in the minister's, what do you call this again? SOC? Integrated Solid Management System. Strategic Outline Case. Can I ask how those numbers compare? Because this is new. This was April 24th.
To you, Mr. Chair. Those numbers were, the corrected numbers were taken into consideration the landfill for the SOC document. So they were adjusted prior to being included in that document. And it looks at the entire projected waste at the site. The numbers that is referred to in HES 7 focuses more on what was actually collected by the vehicles within our fleet, as opposed to the total waste that comes to the landfill. That is what the SOC document would be based on, the overall waste to the site.
So we're saying that there's only probably about 2,000 tons that comes in by private delivery?
Through you, Mr. Chair, that is incorrect. The annual projection for the landfill in terms of total waste is in the region of 80,000 tons. And our trucks, again, this is a range in HES, our range is probably on the lower portion of what comes in there, around 55 to maybe 65,000 tons per year. So the difference would be brought in by the private contractors.
Mr. Chairman, I'm asking all these questions because in the SOC, it is, SOC, they're saying it's 225 short tons per day, which equates to 82,125 short tons per annum. And we're only making provisions for 80,000 tons. With the government collecting about 55, I understand. But the range here, Mr. Chairman, is 60,000 to 80,000 for the government to collect. 60,000 is more than 55. Can somebody explain that to me, please?
Mr. McLean, I think they're asking for clarification as to the question that you are asking.
Which figure is right, is what I'm asking.
Through you, Mr. Chair, the overall figure of tons of 82,000 short tons is an estimate of what comes in, inclusive of what is shown in HES with the 55, 60,000 tons from that is collected by our vehicles that the government collects. The difference and the range of 60 to 80,000, I could see where perhaps it could be a little confusion there, a need for clarity. That range should have yes been revised down to, like I mentioned, probably 55 to 65,000 tons as opposed to the 60 to 80,000 tons.
Mr. Chairman, let me go on because obviously there's that is a confusion that whoever's on this committee can have work out if they're going to put our RFP out. They really need more concrete numbers than they have in these two documents to be able to put RFP out for waste energy management to some private sector company. They really need more concrete numbers. Because
Mr. Chairman, through you, what the RFP is going to be based on is the SOC, and the SOC figures are correct. It's the APS here that really has arranged apparently that's incorrect.
But Mr. Chairman, if that is the case, how are we going to deal with it here then?
Mr. Miller, Mr. McLean, I think that the upper limit of the range here is 80,000, and you're saying that the figure in the SOC, the strategic outline case, is 82,000?
It's more than that, yes. And it's the director is saying that he only collects about 55,000 per annum. I am just saying, Mr. Chairman, we need to get this thing correct if we're going out. We need to make sure that they're absolutely correct before we do that. And anyway, my next...
Thank you very much, Mr. McLean. Thank you.
My next question, Mr. Chairman, is do we have an operational incinerator now?
Mr. Chair, yes. Yes, we do. We do have one on Grand Cayman, and we have one in Cayman Brac for medical waste.
And do we also have air curtain burner at the installation here?
Through you, Mr. Chair, we used to have a air curtain burner at the Grand Cayman facility, which was acquired following Hurricane Ivan. We did extensive burning our operation within that unit, and it is out of service mainly because of some issues with the refractory walls and so forth. So it's really done its time in that regards. We do have a smaller unit in Little Cayman.
How long has this air curtain burner been out of service?
It has been out of service now perhaps about 3 years, probably thereabout, 3+ years. And we have looked into whether or not to replace it or to acquire a new unit, and that is something that will be further discussed and determined in this current year.
But isn't it cheaper to replace the walls on it? I mean, we can bring them in, the refractory walls.
Mr. Chair, I mean, the unit itself, some of the actual structural steel and the supply for the air that feeds the unit along its horizontal has also, over the years, and the intensive heat has also have some issues with that. So that's why when we looked at it in terms of costing and replacing the cost, the difference, we're not too far off in terms of replacing.
Okay. Mr. Chairman, I note that there is no third-party revenues here. Can the director tell us whether or not he picks up this infectious waste for free?
Mr. Chair, so no, there is a $2 charge per pound for infectious waste.
Can someone tell me where that is reflected in here?
And a part of that would be, yeah, this is. He's probably looking at the total cost, but the total cost will be rolled into the overall department. The total revenue will be rolled up into the total revenue will be rolled up into one, but let me. So how you want? One second. Look at the individual 627. That is six, okay. No. Right. Yeah, 630, that's what I was looking for. Sure. So, yeah, Mr. Chair, the actual details, because or individual departmental outputs are rolled up into the minister's outputs, but the details in terms of how much revenues come in from each of the outputs that I am responsible is on page 639 of the document. So the details are on 639.
639 of the annual budget statement.
That is correct.
We are considering the annual plan and estimate. So Mr. McLean, 639 of the annual budget statement.
So are we saying it is not recognized as others are, but it goes straight into general revenue? See, Mr. Chairman, I didn't think of this. I didn't see this one. No, we really getting in some numbers that is totally twisted now. This one 70,000 to 90,000, and this year 13 and 14 is 70 to 90,000, and it 39,000 in this one, and 60 to 80,000.
Mr. McLean, members, at this time I'll take the mid-afternoon break.
Okay.
At which time the Ministry of Health can look at the numbers, and we'll resume in approximately 15 minutes.
This one?
So at this time we'll suspend proceedings and resume in 15 minutes.